Guys, welcome to Headline Buster, brought to you by The Point. I'm Wang, sitting in for Liu Xin. In this series, we dissect stories that are making headlines around the world and talk to my guests to compensate for the missing pieces of the puzzle. So join us in real time by sending us your thoughts and comments via the CGTN page on Twitter, Facebook, YouTube, or Weibo. If you're watching this live on CGTN, email us at thepointwithalex@cgtn.com. Let me know what you think. We might just read out your comment. And also, we start our live streaming every Friday, as you know, at 11 a.m. Beijing time. Get in touch. And before we go into today's segments, I want to show you some of the exciting news. China's got a COVID-19 vaccine that's proved effective and almost ready to go. Actually, we've already received some interesting feedback on social media. So before we go into the details, let me read out some of those interesting comments first. Jane Rollook says, "What is missing in your report is that I would never allow a vaccine that is rushed by Russia, China, the US, the UK, or any country. So many citizens have already decided they will not take this vaccine as no serious clinical trials have been conducted. And as a side note, the virus is like all viruses. It mutates, so any rushed vaccine is highly unlikely to work on mutated versions. What a waste of world media hype and a total waste of money spent on this race for the first vaccine. Shameful." All right, we hear you. Vishal Patel, this friend, says, "If vaccine is invented by China, no one will use it except China. No one trusts China, as vaccine may be another scam by CCP." All right. And Miranda Yo says, "Keep up the good work with the various vaccines thanks to the scientists of China. Asian countries need an affordable vaccine. I'm just so thankful for the generosity that China has shown my country." As you can see, those opinions, they're very different opinions. We welcome your opinion. We might just read them out loud like we did. It's all about perspectives. Regardless, this week we want to show you some of the background information. Before we get into the headlines, we're going to dissect reports from Wall Street Journal, Japanese media, as well as other news media from around the world. Some background information here. The result of hard work, scientific innovation, and years of previous research is considered key here. The vaccine also brings hope to people around the world. But how are the media covering the story? Sure enough, in some media reports, like I said, there is skepticism, paranoia, and even criticism. But before we look at our examples, some background information. The new vaccine is co-developed by Chinese biopharmaceutical firm CanSino Biologics and a team led by Chinese military infectious disease expert Chen Wei. The vaccine has now finished phase 1 and phase 2 clinical trials, which have verified its safety. The phase 3 trial will be conducted overseas and is progressing smoothly, according to the company. And there's more good news here. Other vaccines are also in the works. On August 6th, Executive Director of the WHO Health Emergency Program, Dr. Michael Ryan, said there are actually 165 vaccines candidates in the trials in total. 26 vaccines candidates are in clinical trials, and of the 6 in the final stages of human testing, 3 are being developed right here in China. The other 3 in late-stage tests are being developed by companies based in the US, the UK, and Germany. Another piece of news, Russian President Vladimir Putin last week announced the development of the world's first vaccine against the coronavirus. The first batch will be ready for use in a couple of weeks, according to Russian media reports. As of August 21st, the world has over 22 million confirmed cases of COVID-19, and total deaths has unfortunately reached almost 800,000. I believe at this point, we're all anxiously awaiting a vaccine that actually works. Regardless of who develops the vaccine first, international cooperation is still considered essential. It is a global effort against a global pandemic, and a lot of logistics must still be figured out. Who will get the vaccine first? How much will it cost? And what about people who cannot afford the vaccine? In a way, the hard work, the process is just beginning. Chinese President Xi Jinping back in May promised that COVID-19 vaccine development and deployment in China, when available, will be made a global public good, which will be China's contribution to ensuring vaccine accessibility and affordability in developing countries. Cross-border cooperation is actually already taking place. In fact, all 5 types of COVID-19 vaccines in China are being developed under international cooperation with a list of countries here, including the UAE, Brazil, the UK, the US, and Germany. Potential cooperation between China and Russia is possible, considering China may be able to help Russia with mass production for its second dose of a vaccine, if needed. Now, we're, like we said, going to tell you more about this. This is not a go-it-alone effort. Regardless, vaccine nationalism is a rising concern, and so are worries that countries are sacrificing safety for speed, and that countries will use the vaccine as geopolitical leverage. At least these are the issues that rise to the surface when some media report on China's vaccine development. Let's look at some of them. The Wall Street Journal on August 17th published this article titled, "China seeks to use access to COVID-19 vaccines for diplomacy." It says global health experts expect China, Russia, and other countries to attempt to turn any successful vaccine into a tool of diplomacy amid intense global demand. Well, we've seen this before, no? Like when China was accused of using face mask diplomacy when it supplied other countries with PPE in the early days of the pandemic. So it really should come as no surprise that China is now once again accused of using the vaccine to seek its own geopolitical leverage too. But it gets a little old here. If China offers to help, it's up to no good. If China doesn't help, it's described as selfish and also bad. Sometimes it feels as if China can do no right in this pandemic. The article went on to say that with China closing in on a coronavirus vaccine, Beijing's top officials and some of its drug makers have begun promising early access to countries of strategic interest as it seeks to shore up its global standing after a pandemic that has strained geopolitical ties. Now, the article lists Brazil, Indonesia, Pakistan, Russia, and the Philippines as countries Beijing has promised giving priority in receiving doses and other deals. But when the article explains the reasons behind the cooperation, the details paint a very different picture than the headline suggests. As the article itself mentions, China said it would give priority to the Philippines after its president made a direct plea to President Xi Jinping to give his country access to its vaccines, not the other way around. Pakistan, Brazil, and Indonesia have all agreed to let China conduct clinical trials in their countries in exchange for receiving doses of vaccine when it's ready. As for Russia, he says, Russia may produce a vaccine developed by China's military and China-based CanSino Biologics if the Russian Health Ministry approves. Let's be honest here. Given the current geopolitical situation, would countries like the US or even the UK accept an offer of help or the vaccine itself from China? Well, Russia did reach out to America with its Operation Warp Speed vaccine project, but Moscow was met with a no, the US is currently not open to the Russian medical advances. So, how it goes. Our next example comes from the Tokyo-based Nikkei Asian Review. The August 17th headline reads, "China's lead in coronavirus vaccines raises concern as well as hope. Governmental medical sparks worries over safety and diplomatic clout." The opening paragraph points out that China has emerged as a leader in novel coronavirus vaccines, a development that will enhance its global power, but also raises concerns over safety and the potential for Beijing to use its status in territorial disputes. It reads, "Vaccine diplomacy in China uses the vaccine to wield power is also a concern." But then to back up the claim, it just cites what the president of China is saying, that the vaccine, the COVID-19 vaccine is available in China. It will be made a global public good. Not super convincing there. He also argues that China will use the vaccine as leverage with the Philippines when he says, Philippine President Rodrigo Duterte has urged China to give his country, here I assume the author intends to write country instead of county, priority in the supply of the vaccine despite its territorial disputes with Beijing over the South China Sea. It is possible that China will use the vaccine as a tool to increase its vaccine. Well, it's also possible that China won't. A lot of things are possible. So if one is going to suggest such a theory, it would be much more convincing if they could back it up with something more concrete, no? Finally, we have an article from Bloomberg. The August 17th article reads, Russia's new Sputnik launch raises risks in dash for vaccine. Here we see double doubts centered on Russia's vaccine, but hey, while we're at it, why not throw China into the mix too? And it did. In a section on China, he says, China has already begun using its shot in the military, and those people are unlikely to be able to give informed voluntary consent, according to Lawrence Gostin, a Georgetown University professor of global health law. That may embolden other political leaders to take similar steps to bypass regulators like the US FDA. According to this paragraph, not only is China forcing its military to get a vaccine against their will, but it's also to blame if other countries start bypassing their own regulators. It adds that Trump is already in some ways behind in a race where the US's two major geopolitical rivals have used their authoritarian might to sprint ahead. FDA officials have emphasized that they will clear a COVID vaccine only after careful analysis, basing decisions on, quote, good science and data. Okay, so as you can see, Russia and China are winning the race because they're essentially cheating, or as the article says, quote, using their authoritarian might. Hard work, scientific innovation, and years of research just couldn't possibly be the reason. And by adding that the FDA will only clear a vaccine based on good science and data, is that to say China and Russia are basing their decisions on bad science and wild guesses? And there's more. The article quotes an analyst who says, I think Trump will try to influence the FDA and it will bend, but won't break. Gostin said, I have confidence in the FDA, but I'm very worried. I have no doubt that we could go the path of China or Russia if we did not have strong institutional guardrails. Well, these same institutional guardrails certainly have not prevented the virus from spreading, unfortunately, throughout the U.S., right? Over 5 million cases so far and 170,000 deaths, tragically, so far, with no end in sight. The highest number of cases and deaths of any country in the world, by far. Maybe going to the so-called way of China wouldn't be the worst idea in the world right now. All right, we'll take a short break right now, and when we come back, we'll talk to our guests about China's vaccines, the good news, the doubts, and how the media are covering the story. So for more analysis about China's vaccine, its challenges, its opportunities, we're talking to our guests. And we have with us today Michael Johns from Pennsylvania, co-founder and of the U.S. Tea Party movement. Welcome, Michael. Wang, chief reporter of the Global Times, our old friend. And also Einar Tangen, current affairs commentator. Welcome to all of you, gentlemen. So good to see all of you. So my first question is, as you may have heard from global media reports critiquing China's vaccines, some are saying that China is sacrificing safety for speed. Some are saying that China is only having a vaccine because of its, quote, authoritarianism. But others are saying that, look, it's because of years of research, years of hard work. Michael, what do you think? Which side has a better argument?
Well, it's tough to say that it's from years of hard work on a vaccine that was not known to the world really until early this year, and presumably was not known to China until late last year. I do not know the state of China's vaccine research except what's been publicly reported. I believe there's a great degree of skepticism around the world about what has been China's lack of forthcomingness. And when I say China, I mean the Communist Party of China, the government of China, not the people of China, in misleading the World Health Organization all the way into January about the magnitude of this pandemic, about refusing entry to our own health experts who offered to be helpful to China, both in resolving it for China's purposes and also understanding it from the standpoint of its implications for the rest of the world. That offer was refused. And still to this day, this virus, which originated under the leadership of the communist regime of China.
Right, Michael, we hear you.
Let me finish
what about the
my
vaccine
point.
itself?
We've not
cure
heard
for the problem. All right, Michael, I want to give our colleagues a chance to respond. Wang, what do you think? Basically, Michael was saying that China was to blame from the start. What do you think?
Well, there are so much to unpack from what the news reports and as well as Michael just said. However, I just want to start with by saying that it is reasonable and understandable for some people to have some concerns over the development of the vaccines, because there's a race going on, and a race to save lives, not influence, not diplomacy. And also we have to get this right, unlike President Donald Trump suggests that you can inject disinfectant into your body. This is scientific. This could affect hundreds of millions of people's lives. So we got to get this right. However, what the news reports said and what Michael said have nothing to do with the scientific and accuracy of the vaccine. What we're saying, Michael just raised a couple of points, I think quite old talking points from the Trump administration.
They're not talking points, those are facts.
First of all, you said
you dispute them?
Virus
where did the virus originate? What country?
We don't know. How do you know?
How do you know?
The experts didn't know. It could become from Wuhan. It could become from
in January, let's see if we make some progress here. Maybe we can. I'm of good faith on this, but I hope you guys are. Let me ask you a question.
I don't think so.
In mid-January,
you're just repeating.
Mid-January, January 14th.
Michael had his time. I haven't finished I haven't finished mine. So originated under the leadership of CPC. That could also be said as the virus outbroke or originated under the leadership of Donald Trump or anybody else.
But it didn't originate
here. That is meaningless to say.
Are you alleging that
China's intransparent.
Are you alleging that it did?
Just recently.
Let me understand what you're saying. Okay, let's try not to talk around it. Where did the virus originate? What country?
All right,
you don't know.
Really talking about
you're not in a position of expertise on this topic.
I think we're done talking about
There's
the origins
no scientific
of the virus
research
the global
that
scientific
definitely put where the origin came from.
Einar, we've seen this too many times. The politicization of the viruses. According to WHO, currently, out of the 6 vaccines into the human development, the final stages, 3 are being developed in China. What are the promises, the challenges, the opportunities there? Einar.
Well, the challenge right now is demonstrated by the discussion we just had. Some people see this as political, and others see it as scientific. Obviously, Michael feels that somehow this is all some big conspiracy. And that's fine. He's entitled to his opinion.
I think it's pretty factually.
Michael, you can. This is not your show. You can at least. We did you the courtesy of listening to your diatribe. You can do the same. Now, quite frankly, you just repeated the O'Donnell Associates talk points: attack China, China, China. That's fine. You're entitled to do that. You're the founder of the Tea Party. You've always embraced this us versus them mentality. So that's your point of view. But this is science, not politics.
That's why I want to drill down to facts.
Can you at least have the courtesy to be quiet while somebody else talks? Or do you have to interject?
Not when you're
the only way that you can win your argument? I would expect more from the speechwriter.
Michael will give you a chance to respond, but Einar, please finish what you're saying. Einar.
All right. So at this point, it's very simple. You can see this as a global conspiracy. You can say that it's all China's fault. But if China comes up with a cure, Michael, will you be willing to say it's the China cure, as just as you said, it is the China virus? I mean, this is infantile.
Well,
people are dying. And you want to make political points. And that's disgusting, frankly. You should be ashamed.
No, the political points
that President Bush, who you work for, would be applauding what you're doing today?
Let me ask you and see if you are...
Einar,
you're not
right there. Michael, listen to this.
Michael,
listen to this. This is important. When you talk about some media reports suggesting that China, is only helping countries that serves an interest to itself, like the Philippines, Pakistan, and Brazil. How do you look at those speculation, those arguments? Michael?
Well, there's not a vaccine available, so it is all speculation at this point. It would seem to me that the obligation of the government of China should be to the people of China. And by the way, I think the position of the U.S. government, which I support and am closely in touch with, is that our country, as it was when the pandemic broke out in China, is willing to work with China on vaccine-related research and in trying to make that available to all countries of the world. This has been an immensely devastating pandemic that has affected the lives of many. Our country has gone through an extraordinary series of months and have done some things incredibly well with a pandemic that really was not known to us or to really any country of the world before earlier this year. I only mentioned the facts that I referenced about the origin and the late forthcomingness about the details because there has been a deterioration in trust in the government of China, and that's a demonstrable fact. If we're going to deny that fact, it's very difficult to make progress from there. I think the burden that is on the government of China now is to be forthcoming, which it wasn't at the beginning, in really providing accurate information about the origin of this pandemic, about why it wasn't forthcoming to the World Health Organization, to the world about the magnitude of its transmittability, and why it denied access to the United States and other countries of the world that sought to be helpful, and to begin to see if it has any interest whatsoever in forging any degree of collaborative relationship with the United States, because really just about on every front,
as a matter of fact, there has been cooperation. The CanSino cooperation is led by 5 countries, including the U.S., Brazil. Wang Cong,
on plenty of fronts.
What about vaccine nationalism? Do you believe there is such a thing as vaccine nationalism right now?
Look, I don't want to go back to the conspiracy theories.
It's not a conspiracy theory. For God's sake, you got to be honest about it.
Virus, and also just look at the WHO. Just hear me out. I don't want to go back. I want to focus on vaccine because this is so vital. Many countries,
your credibility has been damaged in the eyes of the world.
I'm sorry. Can you hold on for 1 second? You'll have your time to rebuttal. Many people, millions of people, including Americans, are waiting so desperately for a vaccine. And also, there is, if you want to talk about vaccine nationalism, there is, I think, at least in some Western media outlets, I mean, you've just read a lot of them, there are much more about how countries are racing for the vaccine, not for saving lives, but to have influence. Let's say in the United States, after they accused China's, or they attacked, smeared China's Chinese masks, PPEs quality, they snatched masks, PPEs from other countries, and if the federal government snatched PPE supplies from China, from state governments. So with regard to vaccine, there's also similar pattern happening. Let's remember the U.S. has struck a deal with a German company to have exclusive access to vaccine. What does that mean? Once that company develops that vaccine, it has to provide to the U.S. China has signed deals with all those countries you just mentioned. Where is the nationalism? There's, they're cooperating, including with the U.S. And on the U.S. side, especially in the pundits and the media outlets, there are talks about how China is stealing data technology from the U.S. to develop that vaccine. And also, there's talk about diplomacy, where they have done nothing, including in terms of cooperating to develop a vaccine that could save lives. They're just talking about talking point.
Well, Einar, isn't this high time that countries, societies, people put aside politics and really start working together to find a cure to, save all of us?
Yeah, that would be wonderful, but unfortunately the specter of politics seems to be a constant. Right now, the U.S. is in the midst of an election race. Donald Trump, by over 60% of the American public, they say they're embarrassed by the U.S.'s response. So at this juncture, we have people like, this gentleman here who should know better. He was a speechwriter for President Bush. He did some excellent speeches. Now he switched his allegiance to this kind of a very, very far right idea. So at this juncture, he's trying to make this political. And I think that's reprehensible.
No, not really.
I don't know what you're going to say to the people who've died. The fact that the U.S. has 4% of the world's population, but almost a quarter of the deaths. How is that a victory? I know you support Donald Trump, but you should be able to get beyond that to see that people have needs. And at this juncture, they need a cure, not your kind of
I don't think you're hearing me dispute that fact.
Going on about all these
you're not hearing me dispute
Donald
that
Associates
fact.
talk points.
These aren't talk points, these are facts.
Incredible.
I'm asking
you
to acknowledge or deny them. Let me ask you a question.
I acknowledge that you
Educate
sir,
me.
have let down your country and your party.
We'll have about 1 minute left. 20 seconds each. What will be the solution for a cure to this pandemic? Starting from you, Michael.
Well, number one, we have to continue to explore all therapeutics that are available. We have to continue to have sensible state-based distancing and other safety measures based on the respective clinical conditions in this country. We really have 50 different scenarios in the United States and 50 different states. The vaccine is very important. I think the travel ban that was put on China was very important. And we've really not had any American who's died for lack of medical equipment or medical attention, which is quite an accomplishment. And one of the reasons the United States continues to be the leader in the world for healthcare, the provision of healthcare and in healthcare research.
Wang Cong?
I think the cure is a vaccine, but I'm not worried about that because there are scientists from all over the world working on that. Companies are working on that. Government is supporting on that. So I'm not worried about on the research and development side of that. What I'm worried about is we just witnessed about this epidemic of nationalism, about hatred between countries and races. It's I think it's disgusting. It's not helping.
Facts don't hate.
It actually undermines the process, and it undermines. It gives comfort to the enemy, the common enemy, the virus. Nothing else.
Einar.
Put aside the politics. Let the science dictate what is necessary, and let us hope that there is a cure as soon as possible, regardless of who gets it. It should not be a situation where you hoard the vaccine, as was done by President Trump when he bought up all what he thought was a miracle cure for COVID-19. So, yeah, I really appeal to everybody. The politics is not going to solve this problem.
Michael Johns, Wang Cong, and Einar Tangen, thank you also very much for joining us today.
Thank you very much.
And thank you for this heated. And that would do it for this edition of Headline Buster, brought to you by The Point. I'm Wang Guan, sitting in for Liu Xin. Keep your suggestions and comments coming, and we might just show some of them online. And we hope to see you every Friday, 11 a.m. Beijing time. Until next time, take care, be well.